Good afternoon. I'm Dr. Cliff Robertson. I'm the CEO of CHI Health, and thank you all for being here today. We wanted to take this opportunity to commemorate the fact that it's been a year. It's hard to believe that this coming Saturday it'll have been 1 year since the first case in Nebraska was documented. And as you all recall, that first case was here in the Omaha Metro. A lot has changed in this past year. We know a lot more about COVID-19, but we still have a lot to learn. We've also learned a ton about ourselves. As fearful as we all were in those early days, the medical teams for CHI Health didn't hesitate at all to put their training to work and care for the sickest of the sick across the state. You know, while our clinicians were caring for patients, our research team went to work looking for new and life-saving treatments that we could provide to our COVID patients. But in addition to the research team, we set up an innovations team with Creighton University School of Medicine. And that team did some amazing things as well, like created 3D printed components for one of the personal protective devices that our nurses and physicians used, as well as coming up with an idea to create masks out of surgical wrap material, which is very effective and as far as masks are concerned. And we made 200,000 of those masks for the public. Also, as a true health system, we sent staff and supplies across the region to where the need was the greatest. And at the height of the surge of infections, the CHI Health Transfer Center was asked by the state to act as the state transfer center. And what that did was allowed for the management of the movement of patients between communities, because as you all recognized and witnessed over the last year, you know, surges happened in different communities at different times. And so it was our transfer center on behalf of the state of Nebraska that really was able to move patients that needed hospitalization, sometimes to other communities where they could receive the level of care that they needed. It was also our pleasure to work with the state of Nebraska, where we stood up Test Nebraska, that lab at our CHI St. Elizabeth's down in Lincoln. And we've been working with the states to support the testing needs for the entire state over the last year. You know, we also opened COVID units, in particular at our CHI Health St. Elizabeth's and Midlands, to support the surges in communities. And those units in particularly accepted the transfer of our most vulnerable population, nursing home patients. So while you hear about some of the poor outcomes that occurred elsewhere in the country, we worked very closely with the state to protect that group of Nebraskans and Southwest Iowans that needed to be protected, and our staff at those two hospitals really stepped up, provide something that was relatively unique. We also had people that were afraid of receiving care during this last year in traditional settings, and we expanded our virtual services. You know, one of the things that'll go down in the history books about this pandemic is how quickly both the physicians and the patients adopted virtual care, telemedicine, because of the need and the situation we all found ourselves in. But it wasn't just primary and specialty care that we delivered virtually. We also expanded our capability to deliver behavioral health services virtually, which we all now have learned have really, the demand has grown exponentially as a result of this pandemic. You know, at the peak of COVID-19 in our region, you know, we were caring for on a daily basis somewhere between 300 and 350 patients. You know, I think our peak was a little over 350. Today, that number in CHI Health hospitals is down around 50, and we've been hovering around 50 or so over the last couple of weeks. You know, we did, because we're the largest health system, we did care for the most COVID patients, and that allowed our physicians, some of whom you'll hear from today, and our nursing staff to learn from each other, to learn what was working in our other communities and our other hospitals, and be able to share those best practices to ultimately improve the care that we were able to deliver across the region. Now, we're still focused on delivering great care to those that are sick enough to be hospitalized, but we've also pivoted and begun to focus on getting the vaccine into as many of our community as we possibly can. So I'm going to introduce the folks that are here with me today, because they're all going to have a few comments that they'll like to make, and then we'll open it up for questions. So to my far left is Dr. Renuga Vivekananda, and she is Associate Professor of Medicine and Chief of Infectious Disease for CHI Health and Creighton University School of Medicine. Next to her is Dr. David Quimby. He's an Assistant Professor of Medicine at the Creighton University School of Medicine as well. And he and Dr. Vivekananda, and I call them Q and V spent an unmeasured number of hours working with our incident command, and really the two of them helped shape our COVID response over the last year. To my right is Dr. Doug Moore. So Doug is also an Assistant Professor of Medicine for the School of Medicine, but he leads our critical care team, and he was obviously one of the first physicians to care for some of the sickest of sick patients that ended up in our ICU at Creighton University Medical Center. And his responsibility was to help lead the deployment of not only new therapies, but also resources that we moved between ICUs to care for patients. To his right is probably one of his most important partners, Alicia Dunlap. She's one of our ICU nurses, and she was among the first to care for some of these very sick patients, and I think has the honor of administering the very first dose of remdesivir, if you think back to what a time that was when we had another treatment that we could offer patients. And then to my far right is Julie Granetsky. Julie is one of our vice presidents of operations. She runs our part of our clinic. She runs our clinic operations, and she was instrumental in leading a team that stood up the question and answer line, our hotline, if you remember. We launched that within a few days of the first case to make information available to patients in the region. And she also was instrumental in leading the transition of in-person care to virtual care in our clinics. So that's the group that's here to not only give you make a few comments, but also to answer your questions at the end. Thanks.
Hi, everyone. Thank you for the opportunity to speak today. I kind of want to reflect on the journey that we've been on. When COVID-19 first started, we didn't know a lot about COVID-19, so it was very intense. We had to learn a lot every day, every hour, how to take care of our patients and our healthcare workers. And our main goal was to make sure we keep everybody protected and safe. I still remember the first time going into one of our facilities when we had our first case of COVID-19 and being able to help and work with our healthcare workers, and we did a fantastic job. What have I learned since COVID-19 started? Teamwork is important, critical. We put in a lot of policies, procedures to keep everybody safe and healthy to prevent COVID-19 spread in our health care facilities and our communities. And how do we do that? We all work together. Infectious disease doc, infection prevention nursing staff, our bedside nursing staff, our pulmonary critical care doctors, and EVS staff. We just all work together to make sure we know making sure everybody's masking, we're cleaning all their surfaces, having guidelines so that we don't spread the infection. So it was a team effort. That's what made us all successful. One of the things I get asked all the time is like, would you have ever thought about a pandemic in my career? I've been an infectious disease physician for the last 8 years, and no, I did not think I would experience a pandemic, but it has taught me a lot, how to work together, and you just have to continue to learn and educate and make sure we always keep our patients in the forefront and do the best we can. So that's what we did, and that's what I have learned. And I still think one of the big important things to continue to make sure we are watching for is that the pandemic is not over yet. So we still need to very much continue to wear a mask, do hand hygiene, and social distance until 80% of all of us are vaccinated and we're able to reach that herd immunity. In Nebraska, we have done a fantastic job of all of us working together, and our numbers are really low, and we just got to keep going with that until we are able to vaccinate 80% of our population. Thank you. I'm going to pass it on to Dr. Quimby.
Hey, I'm Dave Quimby. Thanks for having me here. At the beginning, when this all started, there was a whole lot we didn't know about modes of transmission. We did see some things from overseas and earlier parts in this country that were affected, with many healthcare staff becoming ill and units being overrun. So we were trying to be as safe as possible, coming up with policies to protect our folk so that they could be around and able to take care of the population. Things like our biocontainment unit. And then when we learned more, we found out what we needed to do to actually protect our population. One thing that Dr. Vivekanandan mentioned about teamwork, I know that I saw on TV and news articles about, especially in Italy, cheering for the healthcare staff and that kind of stuff, and in New York at a certain time every day. I would also like to really thank the environmental services people, because they are in every single hospital room, whether people are in isolation or not, and they often don't get the recognition that they deserve. The main questions that I get asked these days are about how long am I going to be wearing a mask, and about vaccines, because I've been open with the fact I was in a vaccine trial. Masking might be new here, but it's not necessarily new. In Southeast Asia, it's the cultural norm, for example, if you have a respiratory illness, to perhaps wear a mask to protect those around you. And when we see a lot of people doing that, we have no influenza found in our labs yet this year so far, as of 4 days ago. So I don't know if things are going to change for the future, but it is effective at preventing illness transmission. People ask me what I thought about vaccines. I got it before it had an authorization. My child is in the adolescent Pfizer trial. I don't know if he got vaccine or placebo, but I thought it was safe enough to put into him. Now that a lot of people are able to get vaccines, they can have an extra feeling of security because we know that they work, and it'll be the light at the end of the tunnel once enough people get them. So I would just like to thank all the folk in the hospitals who've been working through all this time, and the behind the scenes people that you don't see in the hospitals, but like operations, who figures out what clinics go where, how we can have the best flow of supplies between places. And yeah, it's been a year. Thanks. Doc Moore.
Good afternoon. Thanks everybody for coming. I'll keep my comments somewhat brief, I think. I just want to echo what's been stated already. I don't think you can overstate my gratefulness, our division as a whole from pulmonary critical care, all the teamwork with nursing staff, with administration, with all the subspecialists, really working together. All levels of care, it's been fantastic. And there's no way we could have gotten through this without that camaraderie and teamwork. That makes the long hours and all of that worth it. The leaning in, everybody participating and being willing to help one another. It's been fantastic. So, Cliff alluded to some of the reallocation of resources. It's been a system effort as well. We were fortunate that we have worked together as a team from that aspect too. So we made sure that we had the necessary resources in all of our facilities to take care of these patients, and we continue to do so. We've kind of hit a plateau, as mentioned also with respect to numbers, but that being said, we're still seeing sick patients. We're still seeing sick COVID patients. We're still putting sick COVID patients up on ECMO support, which is the most advanced life support we can provide in the ICU setting. So, and we're seeing sequelae of this disease state that we're going to continue to learn more about. In April of this year, it kind of was first time described the multi-system inflammatory syndrome in children. couple months subsequent to that, we started seeing some of that in adult patients as well, and we've seen that here in our healthcare system. So I think there's going to continue to be challenges. Our division set up a COVID recovery clinic on Tuesday afternoon, so we are seeing patients that have recovered from their acute illness. We're seeing them back in our pulmonary clinic to assess their lung function and things of that nature, and we're definitely seeing sequelae of this disease, as I mentioned, that is carrying forward beyond what we may have initially anticipated. So I think we still have a lot to learn. I can't overstate the importance of mask wearing, hand hygiene, social distancing, and vaccination as appropriate. All of those things will continue to be important. So with that, I think I'll pass it along to Alicia. Thank you.
Hi guys, my name is Alicia. I'm a nurse at CUMC Bergen. Thank you for allowing me to be here and to kind of share a few things with you guys. I played a unique role throughout this last year. I was, and now work at the bedside, taking care of very sick patients in the ICU at CUMC Bergen. But when this all happened about a year ago, I was pulled off my daily duties of bedside nursing and placed in an amazing opportunity to work alongside these guys to help kind of figure out what day-to-day life with this virus looks like in the hospital setting. How do we move patients from one location to the other? How do we clean the rooms? What do we do? One thing that's really nice is CUMC Bergen has a biocontainment unit, and we had multiple nurses, respiratory therapy staff, EVS workers that were trained already to take care of what would be the Ebola virus. And so we were trained in highly infectious diseases, and I know I had a big group of nurses that were like, oh my gosh, this is really scary, and it's very fearful at the beginning, but those nurses that were trained in that, those respiratory therapists that were trained in that, they, stepped up to the plate and they said, yes, I will do that. That is our duty as nurses in our in the healthcare field, but we also, it's our honor. We are happy to be here. We love taking care of people. We love being able to take care of families too, because that's a huge part of taking care of these patients. With the COVID-19 virus, we just kind of tailored some of our previous practices that we already had for this Ebola disease and kind of shifted things for that direction. I would say a year ago compared to today, we as nurses feel so much more comfortable. And that's, I think, due to the fact from all the support from our leadership and from physicians, other nurses, the support from the community, and this help, this camaraderie that everybody's had and came together to say we want to fight this virus together. So that's really been helpful, and we can't thank you guys as the community enough for being alongside us and cheering us on. It meant a lot. We felt heard. We felt that everyone cared, and it's important to see, and we appreciate seeing everybody else wearing masks and social distancing and everything like that. Dr. Cliff Robertson brought up that I did administer one of the first doses of remdesivir at CUMC Bergen, and I remember being all gowned up in my isolation, and they hand deliver the medication to you because we were still figuring out everything about that medicine at the time. And I remember starting it, and I'm like, okay, I really hope this works. I really wanted us to see just a glimpse of a light at the end of the tunnel, that something would work to help these patients, because day in and day out, we as nursing staff were in those rooms with those patients, some on the ventilator, so unable to communicate with us, but others able to talk to us and tell us about their families, and we couldn't have visitors for a period of time, and that was really, really challenging for them. But it was an honor, again, to be there, to hear their story, to know why they're there, and to hear a little bit about their family and where they came from. It was, like I said, truly, truly an honor to do that. But my last point I want to bring up is kind of the future. What does my day-to-day life look like come in the future? I think we're still going to see, as we have still, Dr. Moore said, we still have seen very, very, very sick patients with the coronavirus, and even to the point of needing ECMO support. So we're here to take care of patients, and that's our job and our duty, and it's our honor to do that. So we will continue to do that. But thank you guys for supporting us and allowing me to share with you guys today.
It's such an honor to be with this team today. I wish that we could bring everybody in the organization here. When I reflect on this journey of this last year, when I think about pre-COVID, as a patient, we lived in a world where we saw our physicians and advanced practice providers in person, in the clinic setting, and in our hospital settings. And we knew a year ago, right before this happened, that COVID was coming. We were preparing and doing our best with what we knew at that time to what can we do to take care of one another as it was headed our way. When I think about post-COVID, when that day came, our world changed and access to care changed, but little did we know how much it would. Our goal from the very beginning was what can we do to take care of our communities and one another. And I remember that day specifically in talking to Dr. Robertson and many others when that happened. It was amazing to see the teamwork and camaraderie right from the beginning. It felt like we lived here in coming together, but within a few days of that journey, so many wonderful things happened. We, as Dr. Robertson mentioned earlier, we created a statewide support call line. We knew that our communities would have many questions and they would want answers. So we created that to provide that support to everyone. We also created a website that had a questionnaire for patients to be able to lean on to provide guidance. And if they needed someone to talk to, we had a provider ready to talk to them right away, and it was available to them 7 days a week. We provided dedicating testing locations. We knew that would be coming. Plans were forthcoming to make that happen, and we quickly put that into place so that patients had a place to go to not only get tested, but also get the care that they needed. And importantly, within those first couple of days, we also put screening practices together. We knew concerns and anxiety was rising in regards to COVID-19, and so you noticed right away when you were entering our facilities and our clinics, questions were being asked to protect patients and one another. And as Dr. Robinson also mentioned, our care models changed. So quickly, it felt like overnight, we moved to a virtual care model. We knew it was really important for patients to be able to connect to their physicians and advanced practice providers right away. And so the providers came together along with so many other teams to be able to provide that virtual resource so that we made sure we were meeting patients where they were to provide that care and support. We are now, looking at it now, we're just like we were then, we're dedicated to providing a high quality and safe environment. So as we've been moving through this journey and with having the opportunity with vaccinations and so many other things, we have options for patients to get their care in person and virtually. We do not want patients to put off their care, so it's really important that you know that you have those options, and that will meet you where you are. So whether you are at home or in your work environment, we're here to take care of you. And I just want to echo, it's this team, it's just such an honor to be here with you all and the CHI team overall and what we've been able to accomplish together along with our state and our community partners along the way in reflecting on the success with our patients. We've been able to accomplish all of this together. So thank you.
So, We all are very used to wearing these things now, so taking them off feels a little funny. But it has been a year that I think we may all choose or we may want to forget, but I don't believe it's a year that we will ever be able to forget. You know, while the hearts of our caregivers, these folks up here represent, you know, thousands of people across CHI that have, you know, really had their hearts broken by all the death and illness that they've witnessed. You know, I think this year has also shown us what we can do when we come together, particularly when it's really centered on or centered around focusing on caring for people in our communities. I know the organization is better because of this experience, and I am convinced that we're better as a community. So with that, I think we'll do is open it up for questions, and I would ask that maybe you just call out who you would have a question for, so we can navigate the podium appropriately, and I'll get out of the way. Sure. Hi, Ru.
We talked about, staffing shortages and just some of the things that have happened over the past year. Do you think that staffing shortages could be a more long-term problem, and if so, how do we solve that?
So I do think that the staffing shortages, particularly for our nursing staff in particular, but also many of the other support staff, you know, respiratory therapy, even our frontline workers that most of the lay public probably don't think about, EVS, our environmental services, our food and nutrition teams. Yeah, I think we're gonna experience an ongoing shortage that really will be driven by really probably two factors. One of which is I think folks are tired, and I think people that are able or close to retirement are probably gonna take this opportunity over the next year to make that decision. You know, I do think there will continue to be you know, hot spots of infection around the country, so there'll be a demand for nursing labor in particular that is mobile, traveling nurses. And so that will create a dynamic where folks will choose that kind of mode of working as opposed to being, you know, attached to a community, to a hospital. And so I think that'll also be an issue. The solution is continuing to partner with, you know, Creighton University as well as all of our other nursing schools and or health professional schools to make opportunities available for folks that are interested in pursuing a career in healthcare. I do think that that these folks up here and the thousands that they represent, I do think are seen a little different in the community by the public today than maybe they were a year ago. I do hear people talking about, you know, interests in healthcare that maybe a year ago hadn't thought about healthcare as a profession that they wanted to be a part of. And so I hope that'll offset it to some extent, but no, we will face, I think, ongoing shortages, you know, for the immediate future for sure.
Well, I've got you there. I'm with you.
Yeah.
The virtual care, you said it was mind-blowing how the changes were about not only doctors, but the patients being cool with it now. So do you have data from, like, let's say 2019, how many calls was the system you did and what you would have done?
Yeah, Julie could answer the specifics, but I think we were doing around 400 virtual visits a month before March, and I think our peak was around 19,000 visits in the month of May, and it's you know, so it wasn't, you know, for us it was an overnight, like, oh my goodness, and both sides, you know, so historically. Part of it was getting the providers, the physicians, and or our advanced practice clinicians comfortable with delivering care virtually, but there was an equal component that patients were like, why would I do it this way, and I'm fine coming to the office. The minute that there was a reason for us to interact a different way, it was amazing how quickly both sides came together and said, we can figure out how to deliver effective, safe, efficient care through digital video technology. Just like you all, and we have learned, I mean, we joke now about, you know, Zoom disease, right? Because we are all of our interactions are virtual. I mean, look what we're doing today because of where we are with the the virus in our community, we're actually able to get you all here together and do something that feels a little bit more like pre-2020. And so, you know, there are a lot of changes, I think, that will continue on for years as a result of what we as a country, as a society, have faced over the last 12 months. And that's, you know, probably true for every business, but it's absolutely true for the healthcare profession. Okay, don't let these people go to waste, and so please pick their brains. I'm just going to interrupt. It is perfectly appropriate to call Dr. V and Dr. Q. So the joke I've made is that you know you've made it when you go, to being a single name, but it's not even like Madonna or Sting. They're a single letter. It's just V and Q. So.
Thank you, Dr. Robinson. Yes. I did not think it would turn into something like this, but I think we have done a really good job and all of us have learned together. But I think the lesson and learning that I have gotten from this pandemic is that importance of working together, but not just a team here. It's the healthcare system, the State Department, the local healthcare system, all the other healthcare system around, all of us working together. Infectious disease is very contagious, spreads really fast. And, one of my concerns is, can we have another pandemic? But we have learned so many lessons. I think we'll be ready next time as well.
Do you have any implications that, COVID-19 could become a seasonal virus just like the flu and that we treat it as such?
Yeah, so I think the virus is here to stay, but it's how virulent it's going to be. So that's why it's really important that we get vaccination. So once we get vaccination and once we reach herd immunity and, we get vaccinated all of our high-risk patients, elderly population, and all of us get vaccinated, then we create this herd immunity, invisible barrier around. And then the vulnerable patients that are not able to get we protect them. So, but I do believe it's going to be a seasonal, but I believe we'll blunt the effect by getting the vaccine. So that's my hope.
Dr. V, while I have you,
Yeah.
so I know long haulers are super confusing to the medical community. Is there any consistent thing that we know among long haulers?
Can you, long haulers?
Long haulers, people who are having symptoms that
Oh,
can't be explained by you guys?
Yeah, so we're learning a lot about COVID-19, like Dr. Moore was saying earlier, not only lungs, but, even having effects in the lungs later on after you recover, even in young, healthy individuals. There's data coming out from athletes that are really healthy, who had mild infection, having inflammation around their heart that they're finding out because they're monitored very closely, like in the NFL. So I think we're learning a lot. We're also seeing a lot of mental health issues because of COVID-19, depression, and, some patients who have had really severe infection that have been in the hospital for so long, when they go home after months of being in the hospital, having post-traumatic stress disorder type of picture. So there's a lot of mental health and other involvement as well. But thankfully, like Dr. Moore was saying, a lot of the healthcare systems, we're starting to have post-COVID clinics and making sure we're monitoring our patients really carefully, closely, and giving the care that they need and learning as we go as well. Thank you.
Since you helped administer remdesivir, do you think that was kind of the turning point in care for COVID patients, or what do you think was that major pivot in how we deal with COVID patients today?
I wouldn't say, I would say that specific medication, remdesivir, was the turning point. I think that the turning point was everyone kind of doing their part. When I say that, social distancing, wearing masks, everything that we had in place to kind of help stop the virus from spreading. And that helped ease things on the healthcare system, definitely. But I believe that us learning more about how it reacts and responds to certain treatments has also been something that has contributed to us having effective treatment. I think that, like Dr. V said, we have seen patients come back into the hospital having had the coronavirus multiple months ago, but we have those post-COVID clinics, so they're catching things earlier and saying, oh, you need to seek treatment and things like that. So I think we have very, very good practices in place post-COVID, but also in place if we have a patient come in, we're starting things sooner. We know that things are effective, and all of that is just time. You know, you try something and do your best to see how it works, and some things do and some things don't.
And you've been dealing with this, since the beginning, being on the front lines. It must have been a roller coaster of emotions from, hitting some of those peaks to then things plateauing. Talk about during that November peak, what you were seeing in the hospital.
It was a constant influx. In November, it was a constant influx of patients, and it was all hands on deck, and it was, how can I help? And it was, I'm going to help work extra. I'm going to do whatever I can to make sure that these patients are taken care of. It was calling and working with our fellow hospitals to get the patients to the appropriate hospital so that they had the appropriate resources. The nice part I would say about being part of a big healthcare system is we have that capability to do that, to move patients from one place to the next and bring them in so that they can receive ECMO, which is something that is at CUMC Bergen here in Omaha. So that it was really nice that we could all just come together and have that communication from hospital to hospital to make sure that we had the right resources at the right place and the right time. I would say that as numbers decreased, it was really nice to hear from my leadership, that day of PTO, you take that, and we want to make sure that you have that time with your family, and that you have time at home, and you have time to, have to yourself. That was a big focus, was taking care of yourself and self-health, and if something's bothering you or you're having issues with something, come talk. There was an open door with our leadership, which was really helpful.
Kind of going off of that,
Yeah.
talk a little bit about just the mental toll that this whole pandemic has taken on you and on the people around you.
I think that it's something that as time goes by, we will always remember. Did I think, again, like Dr. V said, I would be part of, in my nursing career, be part of a global pandemic? No, I did not, but I think that the mental health piece, we've had like I said, again, we've had the resources available to our staff, and there's been multiple emails sent out and just opportunities to have conversations about what's hard, what's stressful, what's challenging me. So talking about it has honestly been the best thing that has helped. I know my husband at home has just, I'm like, we just need to sit down and watch TV. Like, can I just have a moment that we just sit down and watch Netflix and don't even talk about anything? Let's just have a moment. And finding your way to decompress, I know has been a challenge because it's been very, very busy, but also is a good thing when you do find that way that helps you decompress so that you can know that this too will pass. So.
Sadly, there were so many lives lost. Did you in your mind keep any kind of a tally? And then how did you find comfort in your grief? And what was your lowest of low and highest high?
Oh, that's a long question.
So,
yeah. To start, I would say no, I did not keep a tally. I would say as an ICU nurse, we have a very tough skin. And we see a lot, and we experience a lot of things, and unfortunately, we take care of the sickest of the sick, so there are a lot more opportunities for death to be around my specialty. But to be honest with you, I want to do everything in my power to stop that, and working with these guys and with our infectious disease physicians to make that not be the case. We will do everything we can to make that not be the case. For me, my highest of high was taking care of super, super sick patients with COVID-19 and maybe being off for a couple days and then coming back and seeing how much better they got. That is my high point. That is, oh my gosh, this is working. What we're doing for these patients is actually making a difference, and not everybody has to pass away because of this disease. My lowest of low is probably those weeks where you have another patient pass, and then you're there the next day and another patient passes, and we do everything we can, again, to help treat these patients, and medicine can only cure so much. And I think many families saw that we were doing everything we could to help them, but sometimes medicine can only go so far, and it can't. And are we causing more harm than good? Are we helping with quality of life? And that when we had those conversations with families, they were very, very much on board with talking about, we want to make these moments with your family the best that we can, and allowing those family members to come in when it's those end of life situations, and we're there holding their hands and everything. But it's my duty as well as an honor to be able to take care of the sickest of the sick patients. I wouldn't do anything else, so I love what I do.
What's been the biggest challenge throughout this last year for you?
I think to be honest with you, it's taking care of the sickest patients I've ever taken care of in my whole life. I've been an ICU nurse for 5 years, and I've never seen patients this sick in my life. It escalates so quickly, and we can only do so much, or we didn't have, I guess, a year ago, the most effective methods to help manage this. We have so many more effective methods now, but I think that the best way to help manage this is to move forward and look at where we were, and what our success rate is now. To know that when we have a patient that comes in with COVID-19, that we have things in place, we have the appropriate treatments, and that we can do our best to give them everything that we got.
Here we are a year later, and there is still a segment of society that says this is overblown. The percentages of getting it and dying from it are so small. You've been on the front lines. You've dealt with these people face to face for a year. What would you say to those doubters?
I would say that COVID-19 is real. I day in, day out take care of these patients, and I just urge everybody to continue to mask, social distance, and follow those protocols that they have in place, so that we can stop the spread of this. I mean, I see it day to day, so just encouraging you guys to do that.
When you see how things have opened up here, and certainly in other places like Texas, and they're ending mask mandates there, does that give you pause? What goes through your mind when you see things like that?
I'm not gonna get all excited or anything, but I just, again, all that we can do is encourage people, regardless of mandates or no mandates, social distance, wear your mask, and if you're sick or having any symptoms, do stay away from other people. That's all I can say. Yeah.
What do you think worked, and what do you think could have been handled better when it comes to caring for COVID patients?
That's a great question. So I think we've all kind of spoke to the fact that we've learned so much. The pandemic obviously brought a lot of disparate times. It brought a lot of learning opportunities. And in those learning opportunities was how can we function better as a healthcare community? And over time, how can we better care for these patients so we don't experience ongoing losses? I think some of that continues to evolve. Obviously, our initial approach with respect to non-invasive and invasive ventilation has changed over time. So I think we're more cognizant about what route to take with that at the bedside from a pulmonary critical care aspect. Treatments have also evolved. We've had some hits and some misses. There's ongoing research that we've been fortunate enough to be a part of, and ongoing publications, so I think that will continue. Remdesivir was one of the treatment options named And we have seen some success. Steroid therapy has also been adjunctive. We've used that in several cases. So I don't know that I can say there's one silver bullet or magic thing that we've used that has turned the tide. But I think it's the community effort. It's the efforts of all the healthcare team. It's, getting an early jump on treatment for these patients and then following up longitudinally and making sure we're doing everything we can for recovery. So.
How do you keep your team motivated?
I think, Alicia kind of alluded to that. Part of our calling, I think, is this intrinsic want to, right? To take care of patients and to do the best we can. And so I think there's some of that that can't be taught or provided. But as a group, I think we bound together and said, okay, we're going to put our best foot forward, and we are going to approach this because this is what we've been called to do. And as we started to see some wins, that certainly helps. And so I think that was a big part of our motivation is, we have this challenge that's been unforeseen in all of our medical careers, essentially. So we're going to approach this as a team, and we're going to get through this.
Talk about our outcomes relative to national data.
Yeah, absolutely. So, and this continues to hold true. So I think about a year ago when we were in this room and had a conversation, I spoke about our outcomes at that time, and it's continued to hold true. We have been fortunate, and again, I can't applaud our team, both pulmonary critical care, our division, but everybody working together. I think being part of some of these research trials, but also being appropriately aggressive in treating our patients. Has really helped us with our outcomes. We pride ourselves on evidence-based medicine and approach to patient care, and I really do think that has impacted our outcomes and our patient care.
If you could go back to the beginning of this, knowing what you know now, is there anything that you would do different?
That's loaded. No. So, of course, right? We've learned so much. Absolutely, we would have better outcomes earlier on, right? We globally would. It's one of those things that it's, like I said, it's been a great learning opportunity for all of us, and I think we will be better prepared in the future because of this. So it's a hard life lesson that we've all had to face. But I don't know that I would change anything that I could say I would change anything in a fair fashion, right? So hindsight's always 20/20. So of course we have more resources and things available from a treatment perspective now. But in terms of our approach and how we have come together, I don't think I could say I would do anything different.
What about society as a whole? What do you think they should have done differently?
I think that we have all learned valuable lessons about community spread of disease, and I think that is something that is going to impact all of us for years to come, whether it's coronavirus or other viral infections or other infections at large, infectious disease. So I think that this has taught us all as a community, nationally, internationally, a valuable lesson about, preventing spread of disease and how it can impact if we don't.
Mind.
And you do infectious diseases, right?
Yes.
So how does this surprise you?
Well, for a lot of viral infections, there's a whole lot of viral infections. And for most of them, the treatment is supportive care and the body will take care of it. There are a handful of viral infections that we can treat on the respiratory front. A lot of people know about Tamiflu and influenza virus. And you also know that if you have influenza virus and you take Tamiflu, it's not like you're feeling fine like 12 hours later. Okay, so viruses act a little bit differently. So facing a viral type pandemic, you're going in realizing, okay, we're going to have a lot on the supportive care front. Some stuff that surprised me along the way was just people's willingness to curtail some of their normal activities for the benefit of the greater good. That's always a good thing. Yeah, I mean, just the sheer number of people that we've had come through our facilities is a little bit surprising, and how we've come through it pretty well. Still going on, it's not like it's in the rearview mirror, but I think we've done a pretty good job.
There's been a lot of talk about, lessons learned for, the next time something like this would happen. And obviously, we don't know where or when something would happen, but how are we gonna take those lessons learned and turn it into action so that we are ready?
Okay, well, it's always nice to have plans in place beforehand, and she mentioned over there about how we already had for our biocontainment unit trained respiratory therapists and nurses for how to deal with highly infectious diseases. So we have a lot more background on that now. For PPE supplies, hopefully the nation has learned that we can step up production a lot more quickly and have distribution go out faster. The fact that I'm reading a lot about issues with vaccine distribution and those kind of issues, but if you look at it, there's a lot of vaccine going out pretty quickly. Okay, so that is something that we will already have down pat if needed for the future, hopefully. Different vaccine technologies and ability to help create vaccines faster than standard ways, than old tried and true ways with years of testing before getting it out there for an emergency. That is something that's been learned and useful for the future too.
Do you think people would be more willing to pay attention to and listen to the science moving forward if we have other pandemics down the road?
Well, I hope that doesn't get answered.
Yeah.
Okay.
There's a lot of doubters. There's a lot of
I know.
people that say that, this is shifted from day to day, from doctor to doctor, from.
Okay. One thing that I think has been learned is just we all need to have a willingness to say, we don't know it all right now, okay? This is our best thinking right now. This is what we think should happen right now. And that is subject to change next week if what we know changes. So if there's openness about what is known, what is worried about, why you're doing what you're doing, people might be more accepting overall.
We have time for about 2 more questions. So this time last year, we're just seeing those first cases coming out, and now this time last year, we have thousands of people vaccinated. Do you think it would move that quick? When did you expect vaccines to roll out?
Knowing that there was a worldwide pandemic and the resources dumped into it, I didn't think it would take nearly as long as a typical thing. I'm not really into the business side and prediction models and that kind of stuff, but my best gut feeling is we would have stuff rolling out maybe this summer. Okay, so I was off by about 6 months. There's some good and some bad for that. The only thing that makes that a bad thing is the disease was so prevalent, you could actually get informations on vaccines faster than you liked. If there weren't as many people sick, we would still be waiting for information to come in.
Well, I just want to close by saying thank you to this group up here, and again to the thousands that they represent, not only across CHI Health, but really across our larger health system, Common Spirit Health, and really the profession, healthcare in this country. So, they are, this word has been used a lot, so it probably means less today than it used to mean, but they're true heroes that, as you heard Alicia talk about, what they went through and getting up every morning and coming in, and regardless of how tired or how they felt, they were their duty, their honor was to be at the bedside caring for folks, quite frankly, caring for their neighbors and friends that unfortunately contracted this disease. as challenging as this year's been, I do believe that not only are we better as a healthcare organization, but I think we're going to be better as a community, as a state, and I hope as a country. So thank you.